Welcome to RN Osce learning sessions. Today we will go through Station 7, Medication Administration and Updated version. You are a registered nurse working the morning shift in a surgical ward. Your patient is so and so. The patient has been admitted to the ward with a diabetic foot ulcer. Her blood glucose level are being monitored twice daily. She has a known history of type 2 diabetes mellitus with a foot ulcer and is currently on oral hypoglycemic agents. She has no known allergies to medication. Upon assessment, during the routine blood glucose level check at 7:30 am, her BGL was found to be 17 millimole per liter. Our recommendations are: the doctor has prescribed a stat dose of subcutaneous insulin for the patient. Please refer to the patient file for specific details. Ensure check for any allergies. Follow the 3 checks and 5 rights of medication administration. Document the administration properly. Have the process double checked and co-signed by the other nurse. So you have to read the scenario carefully. As always, knock the door, look around for scene safety, ensure privacy of the patient, and perform hand hygiene. Okay. When you enter the patient's room, start by introducing yourself and clearly explain why you are there. Try to speak in your own words, using simple and friendly language. And always try to focus on having a natural conversation that the patient can easily understand. Okay. Hello, good morning. I am your assigned nurse on duty. I am here to give your stat injection to control your sugar level. Is that okay for you? Okay, nurse, why I should have gone through this injection? That's a sensible concern. Your today's blood glucose level report shows it's 17 millimole per liter. As per your treating doctor's instruction, I am here to administer the stat dose now. For better confirmation, could you please tell me your name and date of birth? Okay, here you go. Okay, moving further, let me check your file first for the better confirmation. Here you have to remember that in our recommendation, they clearly mentioned that please refer to the patient's file for specific details. That means you have to check here inside the file for which medication is prescribed for your patient. Here, stat medication Nova Rapid 5 International Unit subcutaneously is on due. This prescription is legible and valid. You have to verbalize. And always explain the procedure to the patient and ensure you obtain the informed consent. Check for any known allergies and verify this against the patient file. Assess the patient's understanding of insulin, including its purpose and possible side effects. And confirm that the insulin prescription is legible, complete, and valid. Carry out 3 checks and follow the 5 rights of medication administration. You have to cross-verify the medication and dosage with a second nurse or a double checker before administration. Ensure that the administration is documented accurately and that the both nurse sign off accordingly. So, don't forget to follow these checks before administering this injection insulin. Am I clear so far? Okay, here you go. As your blood glucose level is not yet controlled by oral hypoglycemic agents, your doctor prescribed subcutaneous injection Nova Rapid Stat 5 International Unit. Do you want to know more about this insulin? Do you want to know more about this injection? Or do you want to know more about this insulin? Yes, it's a rapid acting insulin, a hormone that lowers the level of glucose in the blood. And always ensure you are eating a balanced meal with carbohydrates, proteins, and healthy fats to prevent hypoglycemias. And you should be aware of the signs of hypoglycemia such as shakiness, sweating, dizziness, and any confusion. Drink plenty of water in order to avoid dehydration. Am I clear so far? Okay, I would like to know more about do you have any allergy or allergic to any medication? Okay, let me prepare the medication for you. Take the injection bottle from the rack and verbalize this is Nova Rapid. It's available in so and its expiry is so and it's opened on dash. And for my patient, my prescribed dose is 5 international unit. Here there is no color change or no precipitate or it's clear. Take an alcohol wipe, swipe and wait for 10 seconds. From the rack, obtain and connect the syringe. Withdraw the required amount. Check the medicine in the eye level and verbalize this is injection Nova Rapid 5 international unit prescribed for my patient subcutaneously. Could you please recheck this? Okay. Can I keep this syringe in the kidney tray? Or shall I proceed with this? Keep the syringe in the kidney tray. I need to cross verify my medicine with a double checker. This is Nova Rapid 5 international units STAT prescribed for my patient so subcutaneously. Shall I proceed with this medication? Okay. Here, these are the steps you all are familiar with and are expected to follow. First of all, perform hand hygiene, and it's important to choose the right injection site, preferably the abdomen, thighs, and buttocks. Prior injecting, it's essential to lift a fold of skin subcutaneously. Insert needle at 90-degree angle into the skin, inject gradually and withdraw the syringe at the same angle. Once done, discard the used needle safely. After each procedure, perform hand hygiene. And don't forget to document your medication in the chart and ask to sign by a double checker. And inform the patient that I will be back after 30 minutes for evaluation. If you feel any uneasiness, please press the bell. Here are a few key questions you should be familiar with before approaching the station, or once you can reasonably expect these all questions from the station. Stay calm and confident. With consistent practice within the 6-minute time frame, you will be able to handle the situation effectively. Once again, I strongly recommend that you read the scenario carefully and respond appropriately based on what is asked.